Hey, what's up, sports rehab experts? We're back at it with the last video. This is video number 4 of 4 in the Achilles tendonitis series, how to get back from injury back to high levels of performance. So this last video is going to be all about dynamic exercises that we're going to want to consider. Again, the ability to co-contract at a specific moment in time once tissue capacity has been established or reestablished in the case of an injury. The ability to co-contract at the right moment in time and to be able to do so with the right amount of stiffness is very, very important to both from a performance standpoint to be athletic, but then also to help keep the tendons healthy and help keep load management throughout the kinetic chain, not necessarily just load management as far as the volume or frequency that you might go for a run at, or the amount of volume or frequency of practices. Say if you're playing basketball or in a sport, that's load management from a standpoint of games played and minutes played, or volume of running over a given day, week, month time frame, training log. We also want to consider load management through the kinetic chain, through biomechanics, and being able to efficiently displace that load across all the tissues and not overload the specific tissue more so than another. So the ability to do that, again, is very important for reciprocal and alternating activities that we talked about in the last video. But from a standpoint of sports performance, this co-contraction concept is very, very important from that too. So one of the best ways that I like to do this and teach this is through a single leg hop, but assisted at first with a variety of different bands. So in the video that you can see here is a band that I'm holding on to take away some of the load. And a lot of times this allows you to even get to this exercise. Sometimes when people are even in pain at a moment in time, again, think about there's 3 results you can get from pain, going back to the first video, or 3 results you can get from exercises, which is it makes the pain worse, frowny face, the pain is indifferent, there's no change, or the pain feels better with activity. So again, if there's a little bit of mild increase in your discomfort, but as soon as you stop the activity, it goes away immediately. It's not a bad activity to do, and it actually can provide useful to start stressing the tendon and building a greater capacity back up in the tendon to kind of work through a little bit of that yellow light. So this exercise is a great one to do that. Ideally, yes, you're not in pain, but again, that yellow light consideration, you're okay to kind of do this activity during that moment in time too. And you can play around with the different tensile strength of the band. Depending on how much you choke up on the band gives you more assist, less assist, or if it's a heavier band, then it's going to give you more assist as well too. But what you can see from the video is that we're staying tall. Hip is directly above the foot on ground contact, but the knee is slightly forward, and that's a very similar posture that is experienced during any athletic activity, especially top end sprinting. And that's where the concept of co-contraction comes into play, because all these muscles of the foot, calf, hamstring, quad, glute, need to be active and create stiffness to create positional integrity of that global posture that you see, to be able to create stiffness and not pretty much unfold or buckle up when you hit the ground. You need that stiffness to create postural integrity when you hit the ground, to be able to apply that force into the ground to get that force back up from the ground, that equal and opposite reaction. So this is a very easy way of starting to introduce that. And then once this concept is then understood, then we can take that to skipping. We can take it to, I like these double contact skips, where you hit the ground twice on one foot before you switch to the opposite foot, which again emphasizes the ability to create that co-contraction, that co-stiffness within that drill. And then we can take that a step further into some type of dribbling based activity, where maybe it's not a full out sprint, but we do a little bit more of these frequent strides with that stiffness, quick ground contact times in mind. But from the drill, you can see here, we're really not lifting the foot up above mid shin level. So we're really not performing that full stride that you would with a sprint. So that's going to limit the amount of force that's done with the exercise to make it a little bit more comfortable for you early on. It's also going to increase the frequency and turnover, and it's going to distribute that force over more ground contacts as well too. So a lot of times that's much more comfortable for people to do in the early stages, and again, gradually expose them back into a more sprint-based activity. So that's just in a general sense some of the exercises that I like over a progression to get back into more dynamic activities. It's that band-assisted single leg hops, working on co-contraction, co-stiffness through the whole entire lower extremity, and then transferring that over into some running drills such as a double contact skip, dribbling where we're only lifting the legs and cycling the legs through about mid-shin height. And then once you can do all those in a pain-free manner, then we can start talking about sprinting at different percentages of max effort. So that might look something like 70, 80, 90 before going full tilt 100% in your sprints again. So just some different concepts to think about as you're trying to get someone back into high levels of activity. Again, there's a lot more things you can get more in depth here with that, but that should give you a good working knowledge of some different drills and some different considerations as far as what we're looking for, what we're trying to develop, the qualities that we're trying to train and restore in individuals who have had an injured Achilles, working all the way back into high levels of performance.
Hey, thanks for watching. Hope you got a lot out of the information in today's video. If you like this type of content, if you could do us a huge favor by liking the channel, subscribing to the channel, and hit that alert button so you get notified when any new videos come out your way. Also, if you're a rehab clinician looking to take your clinical skill knowledge to the next level and seeing how you can better help your patients, visit sportsrehabexpert.com, where we got a lot more information that can help you along the way, as well as our certified sports rehab expert course. This is 2 courses that give you a sports rehab residency or an orthopedic fellowship type education in half the time at a fraction of the cost. So visit sportsrehabexpert.com to check out these 2 courses. We have the Human Assessment Mastery course and the Full Body Treatment Domination course. And finally, maybe you aren't a rehab clinician watching this video. Maybe you're someone just looking to keep an active, healthy, mobile, athletic lifestyle without painkillers and frequent visits to the doctor's office. If you're located in Ann Arbor, Michigan, you're in luck. Just visit annarbor.physio and you can set up your appointment today. If you're not from around the Ann Arbor or the Michigan area, no worries. We do a lot of online video consultation services from people all over the globe as well too. So you can reach us at annarbor.physio or at sportsrehabexpert.com, and we'd love to learn more about how we can help you out.